Hello and welcome. My name is Will Falk. I lead PwC's healthcare business in Canada. And I'm joined today by my friend and partner, Vaughn Kaufman. Vaughn's a member of the global PwC healthcare leadership team and has played a number of roles inside of PwC, including running our US payer practice. He's currently got a new assignment in a startup venture inside of PwC, leading our new healthcare entrants strategy. Vaughn, what's a new healthcare entrant?
Well, we look at new entrants as companies that traditionally haven't done work in healthcare that are starting to get into it. So the retailers, the telecom industry, as well as even consumer device companies. In fact, when we look at the Fortune 50, 3 out of every 4 companies have some role in healthcare, of which about half of those we would characterize as non-traditional healthcare organizations or new entrants.
Now, you're not talking about healthcare companies like Johnson & Johnson or existing players. You're talking about who? Which kinds of companies?
These are the companies that are offering retail clinics, for example, so the big box retailers. Yeah. These are apparel companies. In the telecom industry, it's the ones that are providing mobile solutions, and even automotive, financial services. All industries have looked at healthcare as an opportunity to grow their business.
Why would car companies and telephone companies get into healthcare?
Well, so if we look at where the industry needs to go and where it is going, is really starting to put the consumer at the center of the business. And when we look outside of the industry, the healthcare industry that is, a lot of these industries do that already. So for example, if you look at the retail industry, most of their strategy is focused on delivering products and services for the consumer. And in healthcare, as we look at sort of that shift, not only just in the US, but globally, we're seeing a lot of trends that are starting to put the consumer at the center of the model.
Well, that trend towards consumer centrism or putting the patient at the center, that's not just a US phenomena.
Right.
Yeah, we're sure seeing that in Canada as well. I mean, we did some recent research that showed that 83% of Canadians would like to see online prescription refills, 79% want to be able to email with the doctor. There's a whole new level of expectation around what consumers can do based on what they can do with these other industries.
That's right. And here in Canada, we've talked to a number of executives around sort of what the private industry is doing to help engage consumers in a much more meaningful way. Because I think there's a recognition across the globe of the importance of having a consumer engaged, and not only when they're sick, but also when they're healthy and taking greater responsibility in managing their own health.
And are hospitals and physicians taking note? Are they paying attention?
Absolutely. In fact, a lot of the hospitals that we talk to are trying to, they're coming out with what they call patient-centered businesses, and what that really looks at is how to engage when they're not in the traditional hospital setting per se, but when they're outside, how do they use technology and virtual types of care models to engage consumers throughout the process.
Do you see a world in which patients will actually take control of their own information?
I certainly see a world where as more information is created through wearable devices and other platforms, that information presenting to them will help engage their way that they consume healthcare. The reason why we even call them a consumer doesn't take away from the fact that a number of them have serious chronic disease and stuff. Right. It's really in how they behave inside and as they interact with the industries, whether they're patients or not.
So how big is this in America relative to the healthcare system and in absolute terms?
So when we look at it from a pure healthcare perspective, it's a $2.8 trillion industry, but we extend the scope to include health and wellness, which is where we see a lot of the new entrants come in. That's a $267 billion business, including wearables, fitness, nutrition, and the like. It's a less regulated space, so it allows new entrants to come in and do experimentation, again, leveraging what they do best, which is engage consumers.
And that's all covered in the report that you released in April of 2014 through the Health Research Institute. And tell us a little bit about your global report that's coming in. What countries are you looking at?
So yeah, we're looking to see what what themes exist across the globe. So here in Canada, of course, we're doing a lot of research. We're also looking at countries such as Mexico, Japan, India, and Australia, and trying to understand what the commonalities are that exist around this movement towards a consumer-driven model, as well as what some of the various differences in terms of how healthcare gets paid for.
So Vaughn, you're working on the global report now. When's it due out and what will it cover?
So we're looking at probably an early 2015 launch of the report, and the report is examining similar topic around new entrants, but specifically looking in countries such as Canada, Japan, Australia, India, and Mexico, and what trends are similar and what are some of the differences.
So let me put you on the spot. You've been here a couple of days. What's the same, what's different between Canada and the US in your experience?
So clearly the way healthcare gets funded is quite different, but I think there's some similarities in the fact that global companies are entering in the Canadian market just like they are in the US and forming certain and interesting partnerships around it. I think another similarity, which is a really important aspect of the research that we're doing, is putting the patient at the center or the consumer at the center of the system. And I've heard from both private and public companies that the emphasis around the importance of engaging consumers in a meaningful way.
Great. Well, thanks, Vaughn, for taking the time today, and thank you for listening.